WHO welcomes the ceasefire between Israel and Lebanon that took effect yesterday, and we very much hope it's respected and becomes a lasting peace. Although the fighting has stopped for now, the health needs are huge and will only increase. Those needs are more acute now that winter has arrived.
The scale of the healthcare challenge remains enormous. And I think from now until the next few months, I think we have to try to reestablish the health services in the conflict-affected areas. How to reestablish the healthcare services in those conflict-affected areas? Of course, it will take some time, but I think we are working with the partners, with the Minister of Health, to make sure that health services are available for those people who are returning to the conflict-affected areas.
In Gaza, a year ago, almost all those displaced by the conflict were sheltered in public buildings or by family members. Now, 90% are living in tents. This leaves them vulnerable to respiratory and other diseases. At the same time, the ongoing blockade of northern Gaza is limiting the entry of essential resources, including blankets, fuel, and food, all of which are already in short supply. WHO and our partners are doing everything we can, everything Israel allows us to do, to deliver health services and supplies. Once again, the ultimate solution to this suffering is not aid, but peace.
So the first top priority is actually fuel at the moment again. So we're talking again about the lack of regular supplies of fuel. Without fuel, no humanitarian operation at all. We also, again, are back in discussing food. There's again massive food shortages in Gaza, both in the south, with skyrocketing prices for whatever is available, and in the north.
Now to Mpox. Yesterday, the Emergency Committee issued updated temporary recommendations, adding some new recommendations and extending or modifying others. As we have said many times, we're not dealing with one outbreak of one virus, but several simultaneous and overlapping outbreaks of different strains or clades of the virus affecting different groups in different places. So far this year, 20 countries in Africa have reported more than 14,000 confirmed cases, including 55 deaths. More than 75% of all confirmed cases and deaths in Africa this year have been in the Democratic Republic of the Congo, where the outbreak of clade 1b has now spread to 6 provinces, including the capital, Kinshasa. WHO, Africa CDC, and our partners are continuing to support countries to respond to these outbreaks and prevent further ones under one joint continental preparedness and response plan.
What we really need globally, in the US and abroad, is much stronger surveillance in animals. In wild birds, in poultry, in animals that are known to be susceptible to infection, which include swine, which include dairy cattle, to better understand the circulation in these animals. We need much stronger efforts in terms of reducing the risk of infection between animals, to new species, and to humans. And to do that, we need to protect people who are at risk, people who are exposed. We have not seen evidence of human-to-human infection, but again, for each of these human-detected cases, we want to see a very thorough investigation taking place.
The investment round is about mobilizing the resources to implement WHO's global strategy to help keep the world safe and save 40 million lives over the next 4 years. Through a series of events, WHO has received 70 pledges worth $1.7 billion. Of this pledge, 39 are first-time voluntary contributors to WHO, including 21 from middle-income countries. Some of the world's poorest countries have contributed because they see the value that WHO makes on the ground. Along with other funding agreements and partnerships, we can now count on at least $3.8 billion or 53% of the voluntary contributions needed for the next 4 years. This is truly significant because for decades, only a small portion of WHO's total budget was predictable. I thank all countries and partners who have contributed.